Welcome to HealthCurrents. Joining us today is Dr. John Jurica. Dr. Jurica is a family physician and Chief Medical Officer at Riverside. Welcome.
Good to be here.
Thank you. Today's topic is hospitalists.
Yes.
Tell us what a hospitalist is.
A hospitalist is a physician who spends most, if not all of their time, taking care of only hospital patients or inpatients. So it's a little different from a traditional physician who in the past would see you in the office and then also take care of you in the hospital. And so that's where the term came from, hospitalist. It was coined in 1996 and it's been a growing specialty.
So if I go to my family physician and I need hospitalization, I'm in the hospital, I may not see my doctor while I'm in the hospital. Instead, I'll be seen by a hospitalist.
Yes, in some cases. We've had hospitalists at Riverside for several years. Right now, about a third of the patients are seen by a hospitalist rather than their primary care doctor. The reason this has come up is because the office has gotten busier, it's gotten more complicated. Hospital medicine itself has gotten more complicated. And so there is a need that has arisen where you want to have someone who's in the hospital all day long who can take care of you. And so they tend to be a little more specialized, a little more experienced. And so they can deal with those really acute, serious problems perhaps better in a more timely fashion than your own doctor, especially if your doctor, his office is, let's say, more than a few miles from the hospital.
Sure. So at first thought, you're saying, well, I'm not going to see my own doctor in the hospital. That might cause a patient a little bit of a concern, but really, it probably works out in the patient's benefit in terms of the efficiencies that are gained while they're in the hospital.
That's right. Now, don't get me wrong. There's a lot of great doctors that do both. However, it's been shown that when you're cared for by a hospitalist, usually your care is a little quicker. They come in to see you. They have more experience, and in general, their outcomes are better. So you have a shorter length of stay, a little quicker recovery. Because they're there all day, if you need a family meeting or you have someone come to visit and they have a question for the physician or the nurse needs something, they can usually show up and answer those questions in person, you know, rather than have to deal with that over the telephone.
Yeah. And I'm sure the important aspect is the communication between the hospitalist and the family physician.
Right. So what you mentioned is that handoff, or the hospitalist not necessarily knowing the patient that well. So what's really important is that when the primary care is working with a hospitalist, that they communicate with the hospitalist as to what has been going on before the admission. And then during the admission, the hospitalist will interact with the primary care, and at the time of discharge, make sure that they hand off back to the primary care. So that is something that they definitely focus on, and that helps to maintain the quality.
Sure. I would think the other important aspect of communication is between the patient and their family physician. If I'm going into the hospital, I should probably have a conversation with my doctor. Am I going to see you while I'm in the hospital, or will the hospitalist be seeing me?
Right. Now, hopefully you have had that conversation before you're hospitalized. Most hospitalizations are not planned. Some of them are. Your doctor should tell you that if you do get hospitalized, let's say through the emergency room, that you can expect to see a hospitalist. Now, we happen to have 6 hospitalists at Riverside, so it may be one of those 6. Good that that communication occurs beforehand, otherwise you kind of show up and you're surprised. And some patients really have a close relationship with their doctor, and they don't want that to be interrupted without knowing ahead of time.
Sure. Well, doctor, before we go to our final question, we're going to go to Judy for a HealthCurrents update.
Thank you, Carl. Riverside Medical Center and American Cancer Society are making strides to end breast cancer. This weekend, August 18th, join us at Perry Farm for the Making Strides Walk. If you're 40 or over, be sure to schedule your annual mammogram. Don't just think about it, do it. And on Wednesday, August 22nd, please join Dr. Sadie Braun, audiologist with Riverside Medical Center in Coal City, for free hearing clinics for adults and children 5 and older. Thank you, and back to you.
You mentioned it's been 6 years since Riverside started a hospitalist program, but nationally, is this something that's continuing to grow and is commonplace in most places now?
It's definitely growing. It was really a very small number of hospitals back in the 90s that had this kind of program. Then in the 2000s is when it started to grow. There's currently about 30,000 hospitalists, but it's still growing. About half the hospitals in the country have a hospitalist program, still half don't. So because of the need to become more efficient and because medicine becomes more and more complicated every year, we're seeing it grow almost in every hospital, and we see more of our patients being seen by a hospitalist every year.
Very good. Well, doctor, we appreciate you joining us today and shedding some light on the area of hospitalists.
You're welcome.
And be sure and stay current, stay healthy, and stay tuned to HealthCurrents from Riverside Medical Center.